Okay, let's do Parasite take two, because yesterday I made a video about parasites, and since then I have seen 6 patients from across the country who have been diagnosed with parasites. Do they have diarrhea? No, they do not. What's the number one symptom of parasitic infection? Diarrhea. And these people are being diagnosed with them because they're sending their stool sample to these little, backroom labs. Apparently in Arizona, there's a vet who does one of them, and there's another holistic practitioner. Nothing wrong with being a holistic practitioner. I happen to like a lot of them myself. However, this guy is taking your stool sample and testing it and finding things that Quest and LabCorp can just not find. So Quest and LabCorp are national labs. They have very sophisticated equipment. If you have a parasite, they're going to find it. They're going to take your sample, they're going to look through it under their microscope and find it. Well, these people in Arizona, they're looking through their microscope, and yet they're finding things that Quest and LabCorp can't in their little back lab in their house or their clinic or whatever. So that makes my alarms go off right there. And they're also, telling people, and I guess telling doctors that don't understand parasitic infection, that you don't have to have diarrhea to have a parasite. Well, that's amazing, because they've discovered something that the rest of medicine hasn't. Okay, so that's my first problem with it. 6 patients since yesterday. They have parasites. They don't have diarrhea. Most of them are constipated. And I understand people want answers, right? So here I am trying to lay a bit of logic down for us all. Okay, and then, I'm going to go there. The treatment these people are getting is ivermectin. That's the horse medication that got popular during COVID for humans. And if you look on Medscape or any of the medical references, ivermectin is a parasite treatment for 2 very specific parasites. The first of those is a parasite called strongyloides. It is only found on the continent of Africa. So unless you've been to Africa and walked around barefoot, then you won't have it. Oh, it's been found in America in one spot in the Appalachians. So unless you've been to either Africa or the Appalachian Mountains and walked around barefoot because it comes in through the feet, then there's a very low probability that you picked up a strongyloides parasite. Ivermectin can also be used for onchocerciasis, and that's something that you're going to find in sub-Saharan Africa, Yemen, and some parts of Latin America. So unless you've traveled to those places, the likelihood of you having that parasite is slim to none. What I'm trying to say here is, if you really do have one of these eclectic parasites, not the 2 I just talked about, but something else, and it's found on these lab tests from these sort of backdoor labs, then it's probably not the best choice, because it's not really indicated to treat those particular parasites. There's more targeted. What you're going to want to do, if you choose to have one of these people test your stool for parasites, and they report that you have 1 or 2 or whatever parasites come up, you're going to want to take that same sample or another sample, because if it's in you, and run it through Quest or LabCorp to see if they can find it. Because if they can't find it, yet these people, running a lab out of their garage can find it, then, let's just think about that. Anyways, take-home message: parasites cause diarrhea. If you have that, then testing for parasites could be on the table once you've eliminated diarrhea caused by food enteropathy, once you've eliminated diarrhea caused by any kind of other bacterial overgrowth, then sure, go ahead and please use the national lab.